Now it's time for On Point, where we speak to experts to delve deeper into some of the key issues in the spotlight right now. Starting today, the South Korean government will recognize negative rapid antigen test results for travelers boarding flights to the country, on top of the PCR test results currently being accepted.
And with the quarantine period for visitors gone and the use of a less accurate testing method for entry into South Korea, will the country see an increase in the number of infections from overseas? To discuss this, we connect with Dr. Alice Tan, internist at MizMedi Women's Hospital. Very good morning to you, Dr. Tan. And well, first off, what are your thoughts about now accepting rapid antigen tests for inbound travellers to South Korea? Do you think the test is accurate enough to stop a flow of travellers who could potentially be infected with COVID-19?
Well, thank you for having me. That's a very good question. So, there's no test that's 100% accurate. And there has been good correlation between a positive PCR test and a positive rapid antigen test. The problem with rapid antigen tests is that they are very tied to, their sensitivity is very tied to how much virus is actually circulating in a person at the time of testing. So if there are high viral loads in the person, then a rapid antigen test will be positive almost 100% of the time. But when there are lower viral loads, then we start to have problems with false negative results. And we don't know exactly what that threshold level is in terms of, how low a viral load can we tolerate in terms of not being infectious, and then also having it be a false negative that we don't need to worry about. And so that's the question right now is there will probably be false negatives because of the sensitivity of rapid antigen tests, but will these people who are false negative then go on to cause secondary transmission? We don't know exactly, what will happen. The thing about pre-departure testing, though, is when we are able to tolerate a lower stringency of testing, screening at the border, we want to make the process less burdensome for travelers. And of course, the advantage of rapid antigen testing is that it's much faster, much more economical, and so the burden is lower. I think it's reasonable to have a pilot program and maybe see for 2 weeks what the results are. But definitely, as you point out, the sensitivity is lower than a PCR test.
Always been kind of a big concern for me. Even my son, who tested negative for the rapid antigen test, later found out that he tested positive with the PCR test. So there's always some skepticism on that front. But Dr. Tan, also beginning June 1st, travelers arriving from abroad will be required to undergo a PCR test within 3 days of their entry to South Korea. Wouldn't it be safer to just keep the mandatory test requirement on the day of the arrival?
Well, this has to do with pre-symptomatic cases. So people who have been infected, but they don't have symptoms yet. And if the pre-departure test and the post-arrival test is spaced maybe 1 day or 36 hours apart, they could actually both be false negative. But if you have a pre-departure test and then the post-arrival test is, say, day 3, then that could be enough time actually to pick up more pre-symptomatic cases. So it's not necessarily a dangerous option. Of course, the concern would be for people who are going to break quarantine during the 3 days that they're in country, but they haven't been tested yet, if they happen to be positive for COVID and they don't know it yet just because they haven't been tested. So that's really the concern. I think if we make sure that people understand that they're not supposed to be mingling in public unless they test negative, that might be the option. Otherwise, if people don't have that understanding, the risk is much higher.
And Dr. Tan, the BA4 and BA5 subvariants that have been popping up recently, they add to the concerns, of course. And the question is really, can a person who already has been infected with the original Omicron variant be reinfected with the subvariants? Dr. Tan.
So the evidence so far is that natural infection with the original BA1 Omicron strain does not protect very well against reinfection with BA.4 or BA.5. And this is the concern right now in Europe because they are seeing an increase in cases in Portugal. We've also seen an increase in cases in South Africa, and it's primarily due to both BA.4 and BA.5. And so the concern is over the next weeks and months, there may be another surge in cases because of BA.4, BA.5, reinfection cases because of immune escape. In terms of the severity of reinfection, the cases may not be as severe. And that's a bit of good news because there will have been some immunity built up in the system in terms of cell-mediated immunity. But one thing to note is even though prior infection with BA.1 did not protect very well against reinfection, it was found that vaccine-induced immunity offered higher protection levels compared to prior infection. So for anyone who has been infected with Omicron, they should definitely get vaccinated too, because protection from prior infection is not enough.
Yeah, because I think there was a lot of people, including myself, who had been infected with the BA1, who felt like maybe were basically protected from all these new subvariants that are popping up, but also I think a lot of people are basically saying, no use in getting vaccinated if you've already got the first Omicron, but I guess not the case. But speaking of these new subvariants and vaccinations as well, how effective are the current vaccines against these BA.4 and the BA.5 subvariants?
Well, it appears that BA.4, BA.5, these new subvariants do not cause more severe disease, especially in people who have had prior vaccination. So that is really the good news for right now, that for people who have been fully vaccinated, even if they are exposed to BA.4, BA.5, their risk for severe disease is not above and beyond what the risk was for the original Omicron or BA2 Omicron. But the flip side to that is for people who have not been vaccinated yet, the unvaccinated, the severity seems to be about the same. So, they are at high risk for developing severe disease if they do get infected with BA.4 or BA.5.
Well, thank you very much, Dr. Tan, for your insights as always, and looking forward to speaking with you again next week.
Thank you.